Welcome, everyone. Thank you so much for joining us. Our webinar today is entitled From Biochemistry to Behavior, a functional medicine approach to ADHD and anxiety in children. Our guest speaker is Dr. Pamela Compart. My name is Dr. Lenore Powell, and I am a medical education specialist in Genova's Atlanta branch, and I will serve today as your moderator. Dr. Pamela Compart is a board-certified developmental pediatrician with over 25 years of experience in the field. She has also practiced functional and integrative medicine for the past 20 years. She combines both traditional and functional medicine approaches in the treatment of children with a variety of behavioral and developmental disorders, including autism, ADHD, anxiety, and learning disabilities. Dr. Compart received her medical degree from Case Western Reserve University. She completed a pediatric residency at Children's National Medical Center in Washington, D.C., now Children's National Hospital, and was selected for an additional year as a chief resident. After a 3-year fellowship training program in behavioral and developmental pediatrics at the University of Maryland School of Medicine, Dr. Compart was on academic faculty there for 2 years. She later worked as a developmental pediatrician at a local area hospitals and community programs. She ultimately founded Heart Light Healing Arts in 2001, a multidisciplinary, integrated, holistic healthcare practice for children, adults, and families. Currently in solo private practice, she now focuses on her passions of patient care, teaching, and writing. She lectures locally and nationally on traditional and functional medicine approaches to the treatment of autism and other developmental disorders. She is the co-author of 2 books, the Kid-Friendly ADHD and Autism Cookbook, 3rd edition, and the ADHD and Autism Nutritional Supplement Handbook.
Okay, thank you everybody for giving up an hour of your day today to attend this webinar. I appreciate the opportunity to speak with you. Today we're going to be talking about ADHD and autism, ADHD and anxiety. I want to talk to you a little bit about the multifaceted nature of the mental health disorders in children. We'll talk about how to organize the approach and importantly how to help parents feel organized about this approach because they're all overwhelmed. We're going to review some of the science underlying the treatments that I'll be speaking about, and then I'll talk about specific dietary interventions and supplements that you can use for the treatment of ADHD and anxiety. These are really common disorders. The last CDC data is from 2006 from a parent survey, and they found that 6.1 million children, or 9.4% of children between the ages of 2 and 17, had ever received a diagnosis of ADHD. And importantly, 2/3 of these children also had another comorbid behavioral or mental health disorder, and 1/3 of those children had anxiety. And when they looked separately at anxiety, 7.4% of US children had anxiety. So whether you're in primary care or you're in a behavioral or developmental specialty, you are going to see children with these disorders. I'm definitely seeing more children with anxiety, but not just more children. I think I'm seeing anxiety in progressively younger children. And this is not just a genetic problem. Certainly genes predispose children to these disorders. For example, if a child has ADHD, often one of the parents will have it. But the disorders are increasing faster than I think we can explain just by genes alone. And that there's a lot of focus now on epigenetics and what happens around the gene. So while genes make you vulnerable, they're not the whole story. And in functional medicine, we often say that genes load the gun, but environment pulls the trigger. And we're thinking of environment in the broadest sense, what's outside your body in terms of what you eat, the toxins you're exposed to, but also your internal environment, such as your microbiome. I also think a big factor for children is really they have both increased academic pressure at earlier and earlier ages, and they are much more aware of what's happening in the world from exposure to cable TV and the internet. And as I was preparing for this, I realized that one way I've been aware of this is that a common mental health screening question we use for children to get them to tell you things they wouldn't necessarily tell you directly is to ask them, if you had any 3 wishes, what would you wish? And developmentally, 8, 9, 10-year-old children should wish for things like all the candy in the world, all the toys in the world, that I don't have to go to school. And that was what I was seeing 5 or 10 years ago. But in the last 5 years, I would say that the wishes have changed. And while the first two may be wishes for things in their own experience, an increasing number of children are asking for things related to their awareness of the world. They want no homelessness. They want to make sure everyone can eat, that the wars would stop. And while that helps create a more compassionate group of children, for some children, it really exacerbates their anxiety and it can be a negative. And the most poignant example of this is I had a young adolescent male with Asperger's who refused to give me his third wish. And when I asked him why, he said, "If it's okay with you, Dr. Compart, I'd like to save my third wish for an emergency." I don't think children should be having to save their wishes for emergencies. So if they're affected in a negative way by this increasing awareness, we certainly want to try to help lower their anxiety. In terms of diagnosis, it's important to know that not all children who have attention issues have ADHD or have only ADHD. Many have comorbid conditions such as learning disability, anxiety, and depression, all of which can also impact attention, need to be addressed. And the same can happen with anxiety. So you really need to think broadly when you see children with these presenting symptoms. It's also important to note that ADHD and anxiety do not have any diagnostic tests in terms of blood tests or scanning, and that the diagnosis is made by symptoms and meeting DSM-5 criteria for ADHD or an anxiety disorder. And as I tell parents, often children never read our books and they don't know they're supposed to have certain numbers of criteria. So you may have a child who's inattentive, and for the inattentive presentation of ADHD, there are 9 possible symptoms of inattention, and you need to have 6 in order to meet criteria. Many children will have 4 or 5, so they can't be called ADHD, but still having 4 or 5 significant symptoms of inattention is impairing to their life and still needs treatment. So this is where functional medicine is uniquely suited to address these children who are almost but not quite something that we can label. When I'm talking to parents, I always make sure they understand that when I talk about biomedical, it's part of an overall treatment plan, and I often present to them that we're doing outside in and inside out treatment. So outside in is all the supports they get from the school system, from private therapies or tutoring. And that inside out is usually from traditional medicine perspective medications, which I do support and often are needed. Many of the people who come to you for biomedical either will have failed medications or prefer not to use medications. And so that's where biomedical treatments, again, can have a larger role. So today we'll be talking about the biomedical aspect of treatment. As you know, functional medicine is a comprehensive approach that considers looking for the underlying contributing factors to the presenting symptoms instead of just treating the presenting symptoms themselves. Because the diagnosis does not tell you what's causing the symptoms, so we really want to look underneath the symptoms to look for the causes, and hoping that if we treat the causes, the presenting symptoms will also resolve or improve. So I guarantee you that parents who come to you for treatment for ADHD and anxiety have already Googled ADHD and supplements and anxiety and supplements, and they are overwhelmed by the voluminous number of choices that the internet will offer them. And I always say to the parents that they've been given a lot of choices for some generic child with ADHD and autism who's not theirs. And so what we want to try to do through our approach is to help narrow down the choices to be more relevant to their particular child. And what I found has helped parents is to really present this as this is functional medicine is really just we're going to ask and answer 2 basic questions about their child. And the first question is this child's body and brain getting everything that they need to function optimally? And or is something getting into their child's body or brain which is interfering with their ability to function optimally? So in the most basic sense, what we're going to do is give their child what's needed and eliminate what is interfering with the goal of improving function. And this is helpful because it does not require a diagnosis, so it can help a child who doesn't fit in a neat diagnostic box. We just want to help them function better regardless of whether we can come up with a label for their symptoms. At a minimum, we want to make the brain more available for external input and interventions like therapies and special ed. And at best, we hope that we can help the brain enough that they need less external intervention. And this approach assumes that there are factors outside the brain that are affecting the brain and that these factors are potentially treatable. So in terms of what goes under each question, we're not going to have time to talk about everything on these lists, but things that the brain needs to function optimally are a good diet, which includes sufficient protein, clean or organic foods, adequate nutrients. Important ones in ADHD and anxiety tend to be zinc, iron, vitamin D, and magnesium. And today we're going to focus on the most beneficial I found, which is magnesium. A healthy gut microbiome, lots of data about the bidirectional interaction of gut and brain. And in terms of what can interfere with optimal functioning of the body and the brain, histamine from allergies, we'll talk about, is a big factor for some of the children. Variety of different reactions to foods, whether it's sensitivities to gluten and casein, to additives, and we'll talk about a particular chemical that's problematic in some of the children, which is phenols. They can have problems with toxins, whether those are externally generated or internally generated. And oxidative stress and inflammation are huge topics in a lot of different brain-based disorders. Another helpful thing I found in talking with parents is a mentor of mine, Dr. Cindy Baker, has what he calls his thumbtacks theory of functional medicine. And he says, if you came to me and your symptom was that your bottom hurts, and I figured out that the reason your bottom hurts is you're sitting on 2 thumbtacks and I take out one, I did not make you 50% better because you're still sitting on a thumbtack and your bottom still hurts. So to make you better, I have to find all of your thumbtacks. For children, if the first treatment that you do removes a large thumbtack, then you may see a really dramatic improvement. For example, these may be the children with autism who you take gluten and casein out, and in 3 days, the child is dramatically better. But more commonly, you need to remove several thumbtacks before you can see improvement. So if you have 5 thumbtacks and they're all 20%, you take out the first thumbtack, and you've taken out 20% of the problem, you may not see any benefit, and parents tend to get very discouraged. So I'll often explain that we need to remove several thumbtacks before we can see any benefit. And this has really helped parents to be patient and to have more realistic expectations for the treatment plan. So let's talk about diet first. We're going to talk about balance in the diet, especially the need for protein. And we'll also talk a little bit about organic foods and reactions to preservatives. So you all may be familiar with this concept of the standard American diet, which is appropriately abbreviated SAD or SAD. And I just updated the slide, and the incredible amount of French fries that we eat stayed stable at 30 pounds, but the amount of sugar we are eating went up from 140 pounds to 152 pounds of sugar per year. We're eating too much junk food and bad fats, and eating less vegetables, protein, fruits, and fiber. Just like with the computer and data entry, garbage in equals garbage out. A mother wrote this about her child to illustrate how hard it is to sometimes do these food changes that we recommend. And she said, Hippocrates said, let thy food be thy medicine and thy medicine be thy food. She said this is good advice, but was probably a lot easier to follow in 400 BC when he didn't have to contend with 3 McDonald's, 2 Starbucks, and a Cinnabon within a 5-mile radius of the Parthenon. I think when we're making dietary changes, we have to be cognizant of whether they're actually doable by the parents and whether the child is likely to comply for the older children. So an important thing that's really common in a significant number of children is the effect of the glycemic index on their behavior. So the first meal of the day may set the glycemic response for the rest of the day. And for most children, their typical breakfasts, especially on school days, are often carbohydrate heavy. And if you eat a meal that has excessive carbohydrates without adequate protein or fiber to blunt the rapid digestion of carbohydrates to glucose, that glycemic response can result in a rapid rise of blood glucose followed by a crash. When blood glucose drops, the children can become inattentive, irritable, and what we often call hangry behaviors, which are hungry and angry. And it doesn't matter how good a teacher you have, how good a therapist you have, when the child's blood sugar is low, you cannot reason with them until you get the blood sugar up. So for most children, this means if they have a carbohydrate-heavy breakfast, they are inattentive in the middle of their morning at school. So the best way to blunt this response is to make sure that you have enough protein or fiber with the meal, because protein or fiber will be digested more slowly than the carbohydrate, and it will slow down the carbohydrate that's in the stomach at the same time with the protein and fiber. Most parents will say, well, I don't have time in the morning to make eggs or make bacon, and I can't make a breakfast food. And what really helps is to help parents understand that the protein in the morning does not need to be a quote unquote breakfast protein. There's no reason they can't give leftovers from dinner, like a piece of chicken, or give deli meat. So it does not have to be a breakfast food. It's ideal to eat the protein first before the carbohydrate, but that's not always realistic. My co-author and colleague, Dana Lake, who's an excellent nutritionist, tells parents to consider cereal as their child's breakfast dessert. And just like you wouldn't start dinner with dessert, you shouldn't start breakfast with dessert. And she says to then offer the protein first, followed by the cereal. But in clinical practice, I found that's not critical. And as long as they're having protein or fiber with the carbohydrate, that seems to blunt the effect. There is a subset of children who really seem to need to eat every 3 hours to keep their blood sugar stable. And there are some children who, even with eating protein at each of those 3-hour meals or snacks, still crash their blood sugar. I found a helpful supplement to add can be chromium, which tends to moderate blood sugar. If it's high, brings it down. If it's low, brings it up. We don't know the mechanism by which it does that, but it is often a helpful addition for the children who can't sustain a normal blood sugar in spite of appropriate dietary adjustment. So the question is, how much protein is enough protein? So this is from our cookbook, and it just shows that for different ages, the amount of grams of protein that you need per day. So for a 4 to 6-year-old, for example, you need 25 to 35 grams, which breaks down to 8 to 12 grams of protein at a meal. And have a listing here of all of these things that give you 8 grams of proteins. It's not very much food. It's an ounce of meat or seafood. It's 1 large egg. Nut butters work, but you need 2 tablespoons to get 8 grams. For children who aren't on casein-free diets, a cup of milk will give you 8 grams. And I don't have on the list here, but deli meat, 2 slices of deli meat will do the same. And that's often a very quick and easy way to get good protein in without a lot of effort. And also helpful to think about eating cleaner foods that are more organic. There are small subsets of kids who react to things like MSG or react to dyes and preservatives. So it's doable to do as organic a diet as you can, but as you know, organic foods are expensive and not all of our patients can afford that. So the Environmental Working Group has lists that they update every year of their Dirty Dozen and Clean 15. So the Dirty Dozen are those foods with highest pesticide content, ones that are better to buy organic. And if you can't afford to buy everything organic, the Clean 15 would be the ones that are lowest risk to buy not organic. There are a number of vitamins and minerals that children can be deficient in, and they can be deficient in this for several reasons, due to inadequate intake, higher needs, or poor absorption. So for example, if you continually raise your blood sugar, you need to make insulin, and the zinc molecules. Insulin molecule requires zinc, so some of those children will become zinc deficient. And a common reason for poor absorption is a lot of children are being put on acid-suppressing medications for reflux, which is often appropriate, but it will affect your absorption of nutrients. So the other important point is that it's important not just to be treating frank deficiencies, but also it can be helpful to treat insufficiencies. Because nutrition is not what you eat. It's what you eat, digest, absorb, deliver to the cells, and what is taken up and used by the cells. When you have you might have a perfectly normal blood level, but your cells may not be satisfied with the level of nutrient that they're seeing for optimal functioning. And I'll show you some data about how to assess that later in the presentation. So I'm only going to have time to talk about one nutrient, but by far and away, magnesium seems to be the most relevant for children with anxiety and ADHD. It's the most common nutritional deficiency in the population. It's a cofactor for over 350 enzyme functions. It's important for neurotransmitter function. It's needed for ATP generation. It's involved in methylation, sulfation, and glutathione metabolism. And the food sources are things that are not high on the list of most children's preferred diets, which are leafy greens, nuts, and seeds. So the list of magnesium deficiency symptoms is long. You can certainly see hyperactivity and impulsivity, as well as anxiety. It can be related to depression. I also see it being helpful giving magnesium for the kids who are mood dysregulated, those children who get acutely angry, go from 0 to 60, have trouble calming themselves down. Deficiency can be associated with constipation, with an easy startle, with sound sensitivity. Sound sensitivity is a very common symptom in children on the autism spectrum, which makes being out in the world very uncomfortable for a subset of them, and magnesium can often be helpful for that symptom. You can certainly see sleep disruption with insomnia and restless sleep, tics, tremors, seizures. Interestingly, excessive yawning or sighing, perhaps due to air hunger, can be a sign of magnesium deficiency, as well as salt cravings. I'm going to give you a couple of case studies to show the relevance of magnesium. The first was a 4-year-old boy who was appropriately referred from his preschool for evaluation of ADHD because he had an extremely short attention span at school. When I took the history from his mother, he was also anxious, sensitive to sounds, and constipated. When I did his physical, he had a bilateral fine hand tremor, which is very unusual for a 4-year-old. And when I interacted with him, he was clearly inattentive, so I understood the reason for the referral, but it was also clear that he was extremely anxious. He was constantly asking questions. It was clear that his anxiety was coming from being very hyper alert to sounds. If a phone beeped because a text message came in, or a computer beeped that an email came in, or a doorbell rang, he was alert to all of it. And he was most anxious and hypervigilant about any toys would make sounds. So he refused to play anything till he asked if it was going to make a noise. If you go back to the magnesium deficiency symptom list, he had several symptoms. He had anxiety, constipation, an easy startle, sound sensitivity, and a tremor. So I treated him with magnesium. He only tolerated a very low dose of magnesium, just 50 milligrams a day, because higher doses gave him loose stools. But amazingly, all of his symptoms resolved completely on 50 milligrams of magnesium a day, and he never came back for follow-up. So it is extremely rare to have a child who is this straightforward and resolved with a single treatment. But he did not need Ritalin or anxiety treatments. He needed magnesium. The next case study is the other end of the spectrum, an adolescent boy with a complex medical history. He had type 1 diabetes. He also had severe depression and anxiety, which required treatment with SSRIs. And his mother brought him to me because he complained of feeling terrible, and his complaint was that no one believed him. Everybody kept attributing all of his symptoms to his poorly controlled diabetes. So on his review of systems, he had additional issues. I basically said, tell me everything that's bothering you and I will believe you. So he told me everything. He had constipation. He was still anxious. He was still moody in spite of his SSRI. He had difficulty sleeping. He also had really developed very poor endurance. He was a hockey player and couldn't get through a whole game because he got too tired. He was dizzy. He was craving salt. And then he casually mentioned he had a tremor, and he mentioned that the other day he had brought a glass to his mouth and his hand was shaking so much that he'd broken a tooth. So if you go back to the magnesium deficiency list, he had multiple symptoms that suggested that that might be an issue for him. He had anxiety, depression, he was moody, he was constipated, had insomnia, a tremor, and salt cravings. So he had more extensive workup, and he actually had multiple things, not just magnesium issues. He turned out to have POTS, postural orthostatic tachycardia syndrome, and needed to see a cardiologist and go on salt tablets. Because of his endurance being so bad, I checked a carnitine level, which, even though it's not supposed to be low, according to research, and people who aren't eating animal protein, like vegans or vegetarians, I find it not uncommonly. And he actually had a stat alert low level of carnitine at 11. Low normal is in the upper 20s with a range up to about 60. This is a level at which you worry about cardiomyopathy. So he had to see a cardiologist and a metabolic specialist, and went on high-dose carnitine, which resolved his endurance complaints. And because of the severity of his tremor, I sent him to a neurologist, and the first one diagnosed him as benign essential tremor. Parents were not satisfied with that answer, so took him to another neurologist who was certain that the tremor was a side effect from his SSRI and said he needed to come off his SSRI. He has severe depression, so it was not feasible to come off of his SSRI. The psychiatrist decreased it as much as she could, but could not come off of it, and that did not help his tremor at all. I checked the magnesium level. As an aside, if you're going to check magnesium, measuring inside the red blood cells is a more sensitive measure than checking in the serum. You pick up deficiency at an earlier stage, and he was low normal, but not frankly deficient. As I mentioned before, it's helpful to treat magnesium insufficiency, not just deficiency. So one of the ways you can test for deficiencies is to do some functional urine testing. This is an example of a test offered through Genova, which used to be called the ONE test or optimal nutritional evaluation. It's now been renamed metabolomics. And this test looks at analytes that come out in the urine. For example, if you're looking at enzyme reactions that require magnesium, if you don't have sufficient magnesium, there'll be traffic jams through the pathways, analytes will back up, and then they will come out in the urine, and that pattern can be analyzed to figure out which cofactors for the enzymatic reactions are insufficient. And then they color code the nutrients. So if the nutrient is in normal range, it's in green. If it's sort of borderline from a functional perspective, it's in yellow. And then if you have a higher functional need, it is in red. And this is this child's magnesium, which is in the high need range. Just as an example of one of the markers over here on the right side under glycine serine metabolites is a metabolite called ethanolamine, which converts to phosphoethanolamine, and that conversion is magnesium dependent. So you are magnesium insufficient, ethanolamine will go up, and phosphoethanolamine will be relatively low. So I treated him with magnesium. I really thought he was going to need 300 or 400 milligrams a day for his treatment benefit. He only tolerated 200 milligrams a day before he got loose stools. And then I saw him for follow-up a few months later on magnesium and other supplements, and his mood and anxiety were improved. When I asked him about his tremor, he said, "Oh, that it's gone. Let's talk about something else." So we had a very nice response to magnesium. So magnesium can be particularly helpful for anxiety, hyperactivity, mood regulation, sleep, tics, tremors, and constipation. The main side effect for magnesium is laxative effect. For the children who I only want mild effect, hopefully none, I've tended to use magnesium glycinate. It's often labeled now bisglycinate. Also for the children who can't swallow pills, citrate is very bitter, and so glycinate is more palatable if you have to open the capsule and hide it in food or drink. But citrate is best if you need to treat constipation. For the kids who won't take a powder, Nature's Vitality Natural Calm, who makes a nice powder, came out in the last year or two with a magnesium citrate gummy that has 83 milligrams of magnesium citrate per gummy, and a number of kids will take that who won't take the powder. And you also need to balance magnesium with calcium. You're going to supplement if they don't have enough calcium in their diet. So on the flip side, second question, what interferes with brain function? We'll talk about histamine from allergies. Constipation can be a significant issue. We don't have time to talk about it, but if you are significantly constipated and not eliminating your toxins, you can reabsorb your toxins, and that can lead to a toxic buildup, and some children's brains are more sensitive to that toxic buildup. I find this to be most true in children with autism, who often have significant behavioral improvement if they're impacted and you do a good clean out. We'll talk about some aspects of food sensitivity. Microbiome can be an issue. We're not going to talk about that today due to time constraints. And we'll definitely talk about oxidative stress and inflammation. So histamine is interesting. We don't typically think about that in terms of behavior, but if your histamine level is high enough, in addition to traditional allergy symptoms, you can get brain fog. You can see this present as inattention. but also some kids will get irritable and anxious. And I have a subset of children who are interesting, who I cannot explain physiologically why this occurs, but they have behavioral worsening seasonally, but absolutely no physical allergy symptoms. When I treat them with the supplements we're going to talk about, often we can preclude the behavioral worsening or immediately treat it when it occurs in the fall and the spring. So traditional antihistamines typically work by preventing the binding of histamine to tissue, so they're very good for helping physical symptoms, but they're not actively decreasing histamine production or release. So I found that they have limited benefits on the brain effects of histamine. So to help the brain, you need to have less histamine in your blood going to your brain. So two helpful supplements have been quercetin and stinging nettles. They function as mast cell stabilizers, so that if the mast cells are more stable, they don't burst and release their histamine into the blood, which means there's less histamine getting to the brain, and you can see improved brain function. When I initially started using quercetin, I expected only to see attention get better, but I had a number of kids whose anxiety improved. I had 2 kids whose OCD dramatically improved. And for reasons I can't explain, 2 kids with stutter had a resolution of their stutter with antihistamine treatment with quercetin. So what I took from that is histamine aggravates the brain, and I don't really know in any given child how it's aggravating the brain until I lower the histamine and see the response. From a clinical perspective, the one challenge with quercetin for children who don't swallow pills is it is a fluorescent yellow powder. It's a bioflavonoid and it's bright yellow. And some children, particularly kids on the autism spectrum, will reject it if it turns their food or drink yellow. So an alternative to quercetin is a variant on it called alpha-glycosyl isoquercitrin. One brand is Integrative Therapeutics. It's a smaller capsule, so there's less powder and it's much less yellow. It's about 50% more expensive than quercetin, so I usually try quercetin first and turn to isoquercitrin if I'm not successful with the quercetin. In terms of food sensitivities and eliminating foods from the diet, there are definitely kids who can be sensitive to food proteins, most commonly gluten and casein. And so eliminating those foods may be helpful for some of them. But for ADHD and autism children, I typically don't start with these diets because it's too socially restrictive. I use them more commonly in children on the autism spectrum who aren't socially aware that they are eating differently than other people. It's easier to implement. But for children who are cognitively normal and socially aware, it's very challenging to get them to comply, and it's not where I like to start when there are other potentially easier, helpful treatments to do first. But I do want to mention something that you may not be as aware of, which is children who react to phenols. Phenols are natural chemicals that are found in high concentration in a lot of foods that children like: dairy, bananas, apples, red grapes, berries, tomatoes. And they have benefit. They have some antioxidant benefit. And they are cleared in the liver by an enzyme called phenol sulfur transferase, which requires sulfate as its cofactor. There are a subset of children, first described in children with autism, who are deficient in sulfate, so they do not clear their phenols well. They're fairly clear symptoms that are clues for phenol sensitivity. The main one being red cheeks or red ears that come out of nowhere. A child will be sitting there and all of a sudden their ears will be red and hot when they haven't been exerting themselves. Some of the children will sweat at night, and they can definitely get hyperactive, but the quality of that hyperactivity tends to be silly hyperactivity, running around laughing for no good reason. So the treatment for that is to provide sulfate. And the best way to provide sulfate is through Epsom salts, which chemically are magnesium sulfate. We used to say just add Epsom salts to the bath and the sulfate will get absorbed, which works, but you can't sit in a bath all day. So a more helpful treatment is there are now a couple of companies that make a transdermal cream of magnesium sulfate, which you can rub into large muscle groups like shoulders, back, or calves 2 to 3 times a day. And for some children, it's the magic cream for hyperactivity. A subset of children need to eliminate the high phenol foods, but I really try not to do that since they have they're foods that kids like and that they have health benefits. I'll just give you a quick case study about a child who reacted to phenols. It's an 8-year-old boy with high functioning autism and ADHD, normally well-behaved, pleasant child who came to my office one day, and he was so silly, he was acting like he was drunk. He kept falling to the floor and laughing hysterically. And when I did his physical exam, his ears were bright red ear helices. When I took a dietary history from the mother, it turned out he'd eaten an entire pint of blueberries in the car on the way to the appointment. Blueberries are high in phenols. He was having a reaction to phenols. We tried the magnesium sulfate cream, which took the edge off, but not sufficiently. And he had to go off the high phenol foods, and his ADHD significantly improved. Interestingly, they went on vacation, and mangoes are an allowable food on a low phenol diet. And so when the family went out for smoothies, he got a mango smoothie, and he reacted terribly to it. And when they went back to the smoothie place, they found that the smoothie place put apple juice in every smoothie. And so apples are high in phenols, and he had reacted to the apple juice in spite of his efforts to avoid it, phenols. I want to talk next about oxidative stress and inflammation, which are relevant to a lot of neurologic disorders. We're finding not just ADHD, anxiety, but also autism, potentially dementia. Oxidative stress is a condition in which there is excessive production of free radicals. And these free radicals are partially reduced metabolites of oxygen that have an unpaired electron that makes them highly reactive and unstable. And when other molecules encounter free radical molecules, they lose electrons and become oxidized. When this happens, when you don't have enough antioxidant mechanisms to compensate, it can affect cell functioning and result in damage to the cell walls and to DNA. The metabolomics test has a nice marker for this. When you have damage to the cell walls, lipid peroxides go up. The serum marker is better, more reliable, but blood testing is often hard to do, specialty blood testing in pediatric patients. And I found the urine marker to also be clinically relevant. So the white circle is the patient value. If it's normal, in the normal range, it's in the green. If you're in the borderline range, yellow. And then if you're significantly out of range, you're in red. So this is a significant elevation of lipid peroxides, indicating cell wall damage. And the 8-OHDG is a marker for DNA damage in the borderline range. I found clinically it's been helpful to treat lipid peroxide abnormalities either in the red or even in the borderline range. Often get a good clinical response. So why is oxidative stress important in the brain? And one of the negative effects of the oxidative stress on the brain is on the glial cells. And glial cells, in addition to providing structural support to the brain and nourishing the neurons, also are the garbage collectors of the brain and remove the toxins. When there's oxidative stress in the brain, the glial cells do not function well and do not detoxify the brain, which allows toxic chemicals to build up, particularly glutamate, which is highly excitatory and aggravating to the brain. In children with autism, this seems to particularly affect their language and their sensory sensitivities, but it can also affect attention and overall brain function. So the treatment is to give antioxidants, but also to try to combat the effect of the elevated glutamate. One of my favorite supplements to use in ADHD and autism is GABA, gamma-aminobutyric acid, which is an amino acid that functions as a calming or inhibitory neurotransmitter, and it tends to counteract the effect of the elevated glutamate. Clinically, I like it because it may help with both ADHD and anxiety, and since those two disorders often run together, it's a nice treatment to treat both with one supplement. It can help OCD, it can help sensory sensitivities, and also improve language. And I also find it's helpful in a lot of children, even who do not have oxidative stress. It helps in about 50% of the kids. 40% it doesn't have a benefit or a side effect, and about 10% of the kids will get side effects, which primarily manifests as irritability. And I found that they don't accommodate to the irritability, and you have to back off on the dosing. My neurology colleagues will say that GABA cannot be effective because it's too big of a molecule to cross the blood-brain barrier. But just like some people have altered intestinal permeability, some have, I believe, have altered blood-brain barrier permeability. And a study came out in the last year or two looking at both intestinal permeability and blood-brain permeability markers in children with autism, and both were abnormal. So I think the same may occur in children with ADHD and anxiety. If children can't tolerate GABA, or didn't have any effects, the next amino acid I tend to use is theanine, which raises GABA by different mechanisms. So some children who don't tolerate GABA itself will tolerate raising GABA via theanine. Theanine also raises serotonin, which helps anxiety, and dopamine, which helps attention. So it's a nice blend of benefits. It has a similar benefit side effect profile as for GABA. 50% of the kids do well with it. 10% have side effects. And you can also give GABA and theanine together. So I often will have children who benefit from GABA, but I can't get the full therapeutic dosing because of side effects. So I'll back off on the GABA and then add some theanine to it. That has been a nice combination. In terms of antioxidants to use, glutathione is my favorite antioxidant to use. But L-glutathione, the challenge was that it was not absorbed past the intestinal lining, so it did not help much for brain functioning. But a number of years ago, some studies came out documenting good absorption of this S-acetyl form of glutathione, and since I've switched to that version, I'm seeing a lot more obvious clinical benefit. You can also use N-acetylcysteine, or NAC, which helps the body make glutathione, which works very well. The caveat in children is if they can't swallow pills, the powdered form of NAC is extremely noxious and not palatable, and kids won't take it. Alpha-lipoic acid is also a potent antioxidant. In general, I haven't clinically found it to be as dramatic benefit as using the S-acetyl glutathione. So I just a few weeks ago had a 4-year-old with autism who did not tolerate glutathione, and an alpha-lipoic acid had a huge burst in language. So it absolutely can work. And vitamin C is also a good antioxidant. I can't say that I've seen immediate brain benefit from vitamin C, but it is a good antioxidant. So my sort of go-to combination is GABA if kids can tolerate it, theanine if they don't, plus the S-acetyl form of glutathione. I found that to be the most effective combination clinically. Inflammation of the brain also has very negative effects on brain function. Can have similar effects on the brain as oxidative stress in terms of impairing the glial cells' abilities to detoxify the brain. And if you have repeated triggers of inflammation in the brain, so that you have chronic inflammation, you can look like you have a fixed deficit, untreatable brain deficit. But if you can get rid of the trigger and treat the inflammation, you can often see significant improvement in brain function. So the most likely triggers of brain inflammation in children tend to be gut inflammation, either from yeast or inflammatory bowel disease. Particularly in the children with autism, we think there may be subclinical viruses that are triggering inflammation. And for some individuals, gluten is also pro-inflammatory. The metabolomics test has a nice marker for inflammation, neuroinflammation, which is the quinolinic acid marker. And you can see in this patient, it's in the borderline range, almost to the high range. And I tend to treat both either borderline or elevated. In terms of treating inflammation, omega-3 fatty acids have nice anti-inflammatory benefit. What I use the most is curcumin, which turmeric, which also very nice and anti-inflammatory. And for the children, who I think gluten is an issue, we'll consider gluten-free diet. In terms of tying all this together, there's a pediatric neurologist by the name of Dr. Martha Herbert, who's at Mass General, who does a lot of work in autism. And she likens the dysfunction in the brain to an imbalanced signal-to-noise ratio. And signal-to-noise ratio is an engineering concept that basically says if you have a signal or a message that needs to be sent or heard, whether you have a machine or a computer or a brain, the signal needs to be louder than the noise in the background. So how does that relate to the brain? The signal strength, she says, is from the function of your mitochondria, and noise generation comes from oxidative stress and inflammation. So if you want to treat these imbalances, you can support the mitochondria with things like B1, B2, B3, magnesium, carnitine, and then you can lower oxidative stress by giving glutathione, alpha-lipoic acid, or vitamin C. She said when you do that, the signal that often is getting blurred behind the noise will come forward. And you'll have much more clear neurotransmission. Thinking about the brain in this way helped me in that I'd known about oxidative stress and inflammation for a long time, and I treated it eventually. But once I started thinking about it as generating noise in the brain, I thought these kids can't learn to be their best selves with noise in their brain, and I moved treatment of oxidative stress and inflammation up higher on my treatment protocols, and that has made a big difference to treat this earlier rather than later in the course of treatment. So you can see that you can have a real cumulative effect from all these things. If you're deficient in nutrients, particularly magnesium, if your blood sugar is low, if you have too much histamine, if you're reacting to foods, reacting to phenols, you have oxidative stress and inflammation, your microbiome is imbalanced, you're constipated and generating internal toxins, you're taking in external toxins and additives, and your signal to noise ratio is imbalanced. When you tell these kids to go learn and be their best behavioral selves, it is often not possible. So in terms of supplements that I found to be helpful, magnesium is usually one of my first treatments because it helps both ADHD, anxiety, and the whole long list of symptoms that we reviewed. I'll often use GABA as my next treatment because it helps both ADHD and anxiety. And then theanine, either by itself or in addition to GABA, also treats ADHD and anxiety. For the children who have oxidative stress, I'll add antioxidants. And those who have inflammation, I'll add anti-inflammatories. For the children who persist and still have anxiety, I will and I'm clear with them that 5-HTP is raising the same neurotransmitter as the SSRIs. If they don't want an SSRI, they probably don't want the 5-HTP either. And then treat allergies in those children who are symptomatic or whose behavior worsens with change of season. And then I'll finish this list with a supplement that I cannot tell you scientifically how it works, but it is my first line treatment for anxiety. And I saved it for last because I can't explain it. It is a flower essence called Rescue Remedy by a company called Bach. The premise is that just like we have chemicals in flowers that we can take out and make medications from, that there is an energy or an essence to the flower that you can take out and put in, prepare in a certain way and get into a liquid. I don't know how they work any more than I understand really how acupuncture or homeopathy works. I suspect they're all working down at the level of vibrating energy at the subatomic level, but I don't know. But these are drops that they make for kids. I would get the kid version because the adult version has alcohol in it. The kid version is in glycerin, so it tastes better and is alcohol-free. And when these drops work, they work in 50% of people, kids or adults. I found no clinical predictors to know who's going to benefit, but when they work in minutes, anxiety will be lowered. They are drops you put on the tongue, not under the tongue like homeopathy. And you can use them as needed, or you can use them routinely. Give it 3 or 4 times a day. The dose for kids and adults is the same, 4 drops. And the kids version is the same strength as adults, so adults can take the kids version. It's been impressive when it's worked. A year ago, I had a 16-year-old, moderately to severely autistic young man who was minimally verbal, who had never been able to have a dental exam because the light from the dental experience bothered him, and he wouldn't let them put sunglasses on because he was so sensorily sensitive. He would never let them put anything in his mouth. And I put him on Rescue Remedy, and a month later, his parents sent me a picture of him at the dentist with sunglasses on, stuff in his mouth, calm as could be. So that was very convincing that it was not placebo. So, and this is, it's a $12, $14 bottle, worth a try. I had another child, 7-year-old child, that really helped his anxiety. His brother was flipping out one day and his mother was exacerbated exasperated and didn't know what to do for him. And he just looked at her and said, give him my drops. That's what you should do. So when they work, they're great. And I really have virtually never seen a side effect. Most helpful dietary changes tend to be giving protein and fiber in the morning to blunt the glycemic effect, increasing phenols in the kids who have suggestive symptoms, the subset of children who react to red dye and MSG to really try to avoid sources of those. And if really other things aren't working, to think about elimination diet like gluten-free, casein-free diet. Co-written 2 books with a brilliant nutritionist, Dana Lake. We mostly wrote the books for families who did not have access to functional medicine physicians or could not afford them. The cookbook is, half of it is all about different diets, elimination diets, how to decide what might work, how to do the diets, and also a long chapter on how to eat healthily, not just what to eliminate. And the supplement book we wrote to teach parents how to think like a physician in terms of how do you decide for a given symptom which supplement to use. And the second half is a lot of science for more sophisticated parents or professionals. So I'm hoping by going through all this, I've convinced you that the old paradigm is that ADHD and anxiety disorders are primarily brain-based, that they're primarily treatable with medications and behavior therapy. But the newer paradigm from a functional medicine perspective is that a significant portion of brain symptoms can come from problems that are originating outside of the brain, and that these factors are potentially treatable. So in summary, these are ADHD and anxiety are very common in children. Functional medicine offers a variety of potentially helpful treatments to correct the underlying contributing factors, and doing this often improves overall brain function, resulting in improvement in a variety of symptoms. Thank you for your attention, and I'm glad to take questions.
Thank you so much. That was an incredibly wonderful presentation. I learned so much. We did receive quite a few clinical questions, so let's go ahead and start with this one here with regard to magnesium. Knowing that there's many different forms of magnesium, do you have specific recommendations for when to use one form versus the other form? If there's variations in dosaging, and if you could just share a few different brands that you typically use for magnesium, that would be great.
So again, I mostly am looking for palatability in kids because many of the patients can't swallow pills, and also whether I'm trying to have laxative effect or not have laxative effect. So I tend to often start with magnesium glycinate or bisglycinate, again, because it's sweeter and it does tend to be better absorbed than things like magnesium oxide. So I'll use magnesium glycinate. The trick for kids is trying to find low enough dosing to start with, because adult products are often too high dose or often have calcium mixed in, which is too high. So the 2 brands I tend to use for magnesium, I tend to use Claire Labs, makes a 100 milligram capsule of magnesium bisglycinate, or I use Kirkman Labs, Kirkman Labs. It's been around for decades. They've done a lot of work for children with autism, and they ultra test all their products for 900 different contaminants before they'll make a product. They also make a 100 milligram capsule. And again, for kids who need magnesium citrate, some of the kids do well with Nature's Vitality Natural Calm, which makes a powder. And again, as I mentioned, that same company came out in the past year or so with a magnesium citrate gummy. It's about 80, I think it's 83 milligrams per gummy. In terms of dosing, a lot of my colleagues will say you can dose to bowel tolerance. I have found I don't need to go that high. In children, the younger kids tend to be on 100 or 200 milligrams, and maybe the teenagers may need 300 milligrams. Just haven't found that they need quite as much. Perhaps I'm moving on too quickly instead of pushing magnesium higher. But I often will get clinical benefit without having to push till the kids get diarrhea.
So for the transdermal cream with magnesium sulfate,
Yes.
Can you please provide a brand or a product brand that offers that?
Sure. So one option is, again, Kirkman Labs. The website is kirkmangroup.com. They have a magnesium sulfate cream. It comes with a little scoop with it. That's about 1/4 teaspoon, and the dose is 1 scoop. Again, I use that usually twice a day. Some kids need 3 times a day. Again, I would massage it into big muscle groups, shoulders, backs, or calves, so that's where there's good blood supply. And if you wait half an hour, then they can go in the pool. You can put on other lotions. It'll be fully absorbed by then. I believe another company is New Beginning. Also makes a cream. It tends to be, it doesn't come with a scoop, but I think it's also 1/4 teaspoon. So it's not very much. It tends to be pretty well tolerated. Occasional kids will get a little bit irritable from clearing out the toxins, but that's not very common. And some kids will get a little skin rash, not allergic rash, but just sort of a bumpy rash. So I just tell parents to rotate the sites so that they're not just blocking the same skin pores repeatedly. When it works, it's a high benefit, low risk intervention to try, and it's usually worth one. If you have suggestive symptoms, it's worth investing in 1 container to see if it helps.
We had another question asking about phosphatidylserine. If you have used it in the past, have you found that to be helpful?
No, there were a couple of studies that came out looking at phosphatidylserine and finding some clinical benefit on ADHD in a small subgroup of patients. So after I read those studies, I used it, and I have to say I was not impressed that I saw any significant clinical benefit. So I have not been using that in my practice.
We have another question. This is something a lot of clinicians and parents run into. What companies offer children supplements? So, in the beginning, you listed a lot of nutrients needed for children who either have ADHD or anxiety, such as zinc, iron, vitamin D, and magnesium. But what supplement companies can clinicians look at for help with that?
Like in terms of, well, you're answer that in 2 ways. So I think you have to help parents be good purchasers of supplements, because you want to make sure they're getting good quality supplements, not just, so guiding them to brands is often helpful. I would say Kirkman Labs, I'm gonna come back to that again, as a company. Again, I like that they've invested millions of dollars in technology to ultra test the source materials that come in, and they will not make a product that the source materials are not clean. And they offer sort of kid appropriate strengths of supplements. So I often use they have zinc liquid, they have zinc capsules, they have vitamin D, they have some variety of multivitamins. I use their GABA often. They don't have a theanine. Theanine, I often use Gero formulas. For quercetin, I often use Gero formulas. For quercetin, I try to find ones that don't have a lot of B vitamins in them, that are just pure quercetin. So I'll use Now Foods, tends to have a 400 milligram quercetin. Gero formulas has a 500 milligram capsule. So those tend to be good products. Claire Labs tends to make some supplements in appropriate doses for children, like zinc and D. Then I do counsel patients to be careful about ordering off of Amazon, because they use a lot of third-party vendors that I'm not convinced that they vet well enough for knowing how the products are being stored or that they're not being diluted. Some practitioners I know have signed up through Emerson to use Welevate as a supplement supplier, to make sure that Welevate, Emerson supplies specialty pharmacies, so that that supplements are being handled well. So if you are a practice that wants to sell supplements, signing up for a Welevate account may offer your patients quality supplements as well.
Thank you so much. And in the interest of time, we're going to end our question and answer period there. So for additional education materials, we'd like to encourage you to visit our website, www.gdx.net, or you can contact client services. We also offer complimentary appointments with our medical education specialists to answer any questions related to our testing, including choosing the right test and reviewing patient test results. Finally, I'd like to remind everyone of the many non-invasive profiles that we offer at Genova to help service your telemedicine patients. You can refer to the website for more information or contact client services. And next month, we have Dr. Warren Brown presenting on advanced pattern recognition in the GIFX comprehensive rapid review of cases, and several dynamic speakers and topics to follow in the upcoming months. So please stay tuned and refer back to our website. Thank you again, Dr. Compart. That was really a great presentation. I have a bunch of my notes here on the side that I'm really excited to, start looking more into.
Thank you.
All right, enjoy.